Hello, everyone. Welcome to another episode of Dr. Tashambi Speaks. I am Dr. Tashambi. I want to thank you all for tuning in to my YouTube channel. I want to thank you for liking and sharing. And I also thank you for the comments that you all make in the comments section. It's always so refreshing to hear your viewpoints and opinions about the videos that I make. I want to ask you to please remember to subscribe and tell your friends, tell your coworkers, tell your classmates if you're still in school, tell them about the video channel that I have put together because my goal is to assist newer nurses just kind of navigate through nursing in general. And I do know that I make videos to help out some of our more seasoned nurses, but I do tend to look at some of the issues that the younger nurses, and I mean younger in terms of profession, are going through and just try to give you all videos to help you navigate through some of the questions that you might have. So today I do want to talk about, you see the title there, Dear Nurses, what do you do if your patient hits you? I want to talk about that because to me, it seems like it's a little taboo. It's almost as if you get hit by a patient, it's something that you did wrong. It's something, it can make you feel embarrassed in the moment when it happens. I believe that it can make a person feel ashamed, almost as if it's something that you did wrong. And what I want you all to know is that when we go to work every day, we have a right to come home and not have a patient placing their hands on us, kicking at us, spitting us, calling us out of our names. And everything I just named has been things that I've seen occur throughout my career as a nurse. I can remember when I was 19 years old, I was an LPN working in a nursing home, and I was trying to help a patient get up so she could come and have her lunch. And I'm telling you, that lady slapped me so hard in my face until my face was just numb. And I can remember really thinking like it was just part of the job. And so what I want you all to know is patients assaulting us, verbally abusing us, that is not just part of the job. And if it does happen, I want you all to know that there are things that are in place in order to make sure that you are safe and to ensure that it doesn't happen to you again. And so we're going to talk about some of those things. Before we do that, I do want to ask you all, nursing, we do our assessment. I want you all to assess yourself and kind of think about this because this isn't something that I find that we really talk about a lot. It's almost like it happens and everyone, just kind of acts like, oh, there's nothing to see here and go on back to work. And everyone just kind of goes back to work like nothing never really happened, even though it really did. And I'm just wondering what type of care is even given to the person who experienced the assault. So I want to ask you these questions. Number one, do you feel like it's your fault if a patient were to hit you or when you were hit by a patient? Do you feel supported by nursing leadership or administration, or even your coworkers if a patient assaults you? If you were assaulted, did you fill out an incident report? Did you go to employee health after you were assaulted by a patient? And if you were assaulted by a patient, did you feel that the organization's policy and procedures related to an employee assault was adhered to? So all of those questions are important. One of the things that we want to make sure we do if we are assaulted by a patient, if a patient spits on us or kicks us, we want to make sure that we do go to occupational health because we want to make sure that we are assessed. Now, I know on the unit, people feel like it's one more person, it's a body gone, but at the same time, no one's going to take care of you like you. If a patient kicks you, you don't know what type of injury internally occurred to you as a result of being kicked by that patient. So I highly recommend that if something happens like that, that you do fill out an incident report, see about yourself, do some self-care. Go ahead and do an incident report and let your supervisor know, let the charge nurse know that you would like to be seen by occupational health, because what you want to do is you want to get something documented that in indicates that this incident did occur in case you experience some type of physical or emotional feelings related to this particular incident. Now, I do want you to know here in Michigan, in the House of Representatives, there are two bills, HB 5084 and HB 5682, and those two bills are being pushed by two representatives because what they want to do is make sure that when people, patients, and or their family members injure a nurse, they want to make sure that there are harsh penalties put in place and hefty fines put in place as well in order to make sure that this type of behavior is not acceptable. And I appreciate that. I appreciate them for looking out for us because, like I said, for too long, I believe that nurses, we just kind of take it in stride, take it on the chin, sometimes literally, and we just go along with it. And I know that it is unacceptable. And I just want you all to know that it is not part of the job. Okay? I really want you to know that. So, I just want you to know that as I conclude here, I want to talk to you all a little bit about Nursing Detroit. It is a Facebook community, and it is a place where you will be supported. It is a place where you will learn a lot. You will hear topics such as what I'm talking about. I'm the lead mentor in the community, and I just want you all to consider joining. Tell your friends about it, and we're celebrating another year coming up. There's going to be a celebration, and if you are a part of the community, you will definitely be welcome. And I just want you all to know that if you have questions, I'm asking you all to please send your questions to drtashambispeaks@gmail.com. And I also ask that you all follow me on Instagram at Dr. Tashambi Speaks, and I look forward to your questions. I want you all to stay safe out there, and once again, I can't help myself, shout out to the new nurses. Congratulations on your nursing license. Until the next video, I'm asking you all to please stay safe out there.